Welcome, everybody, to another edition of Manifest Equity, where we are looking at the world as the new changes take hold and looking at how we can create greater opportunities for understanding, greater opportunities for equity. And today I'm super excited because we're going to be focusing a little bit in the field of healthcare and in some ways the way that healthcare intersects with equity. So my two esteemed guests today are Angela Wilkes and Linda Nash, and I will give each of them an opportunity to introduce themselves to you. Let's start with you, Angela. Tell us a little about yourself.
Okay, I'm Angela Wilkes. I am the president and currently the president and CEO of A.T. Wilkes and Associates. I do connections in the C-suite for healthcare executives and hospitals and minority-owned businesses, minority and women-owned businesses. Right now, the focus, as many of you may assume, is on Black-owned businesses so that they can get more into the healthcare supply chain because of the most recent demands on equity, minority business equity, as well as the numbers of patients that are Black and of color that are experiencing the COVID-19 symptoms and death. They have the highest death rates and actual contract rates. So it's a busy time for us now.
Indeed, indeed. And I'm so happy to have you here today. Angela has actually worked with, she's part of our extended TMI family with a career in supplier diversity.
Yeah.
Back before that was really a thing, you were building up supplier diversity across healthcare. So you're a legend in my mind, and it's an honor to have you.
Thank you. Thank you so much. I'm glad to be here, and thanks for inviting me, Tiffany. It's great to work with you.
Yay, thank you. All right, Linda Nash, one of my very own mentors, the esteemed Linda Nash. Tell my beautiful viewers about yourself.
I am a serial entrepreneur, and I started out in the workplace childcare business, and then I transitioned to healthcare with a company called PartnerMD, one of the first concierge in Richmond that expanded coast to coast. And now I have a new company called WelcomeMD with 2 L's that is trying to take concierge to the next level in terms of DNA testing for health, fitness, sleep, stress, hormones, and to be very, very proactive with people in terms of anti-aging, regenerative, and a lot of help coping with all of the stresses that we are all under. The other thing I do is consulting. I've never looked for a client, but clients find me. I was honored to have Tiffany as one of my clients years ago, and often I am doing consulting with women almost completely, small business folks, helping them grow, helping them find investors, helping them take it to the next level. So that's the other hat that I wear in my professional life.
Well, thank you so much, Linda, because it is, yes, we definitely found you and the work that you did with me. You want to talk about manifesting equity. You opened up my mind as a small business owner and really showed me what the options were. I wasn't thinking about, growth strategy and valuations and exits and things like that. And you really, really helped me reconsider the way that I saw my own leadership, my own trajectory. And everything that you have done and offered has been such a valuable resource for me. So thank you so much for being here.
Well, thank you. I appreciate it. This is going to be a fun conversation.
It is.
Yes. All right. So both of you have really deep roots in the healthcare space, right? So we are currently doing this via Zoom because we are, we're trying to be responsible as we navigate pandemic at a scale that we have not lived through before. And we're watching, businesses pivot, businesses fail, businesses emerge. So what are you all seeing as far as, kind of what is trending in the spaces that you occupy? How has work changed? How has your interaction with the healthcare industry shifted as a result of the COVID pandemic?
Well, I'll start. We have introduced remote memberships, and it's been really interesting because there are a lot of people who are out in the country that aren't right in the Richmond metro area, for example, or the Charlotte metro area where we have another office, and they still need this healthcare. And a lot of people have been sort of awakened to the fact that they need a physician partner that they can call at any point with a cell phone or text or email, partly out of fear at first because of the scope of what COVID does, but also rethinking the membership doesn't have to be in person. I mean, we always want to get a physical, so that piece needs to be, but other than that, we've done a lot through DoxyMe, through telehealth. It's not quite the same, I will say, and the docs say it too. They're like, I really miss sitting across, but you can get a lot done, and in a way it's more efficient because you can put the labs up on the screen and go over them and really get the person's full attention. No one's interrupting you. So we've changed that. We've changed a lot of the ways we think about working. I'm much more intentional when I have a meeting now. We are starting to meet around a really big, long conference table, but I don't do it just to do it. I do it when there's someone new who needs to see us for some reason. If we can do it virtually, I am. It's like you have to get real intentional. And then the other thing, I've just tried to be really sensitive to stress levels of everybody that works with me, their situations, their home situations, if they're working at home, who's at home, what other stresses are they under, and look at verbal cues and different things and sort of stop and say, you seem really stressed today. What's going on? Talk to me, because this has been an incredibly stressful time for every human being on the planet. And in our professional life, we like to pretend like we've got it all under control, but we truly don't.
Yeah.
Really don't. So that's the other thing I've been trying to do.
That's amazing. Of course you're doing that. That is literally the advice that I'm having to give all of my clients, is to remember the humanity, right? To remember that not only in each of our individual humanity, but we're all being both collectively and individually traumatized every single day. As if COVID wasn't enough, right? Then we also now are in the biggest civil rights movement in the history of the world. So I don't care if you're black, white, or anything in between, we are all suffering. So of course, and I'm so proud of you and so grateful that you are taking those cues and listening to people and allowing them to have feelings and stress at home. That's just reality.
I was just at the clinic before I came here, and I walked around and talked to 4 different people about how they were experiencing the civil unrest and what they were doing. And a gal who's in her 70s, who's worked with me for 20 years, is doing our billing, Pam Hobson. She was like, I went to a protest in Powhatan and it felt so good, but I don't know about going into the city because I've got risk factors. And it's just that dialogue, just talking about it and making people feel it's a safe place to talk about this.
Yeah. Well, I will just go ahead and give the plug for WelcomeMD. I used to be at PartnerMD, switched to WelcomeMD, and my physician partnership healthcare relationship has never been stronger. And when this went down, I was so happy because I was like, I mean, we already have a relationship via text, and I know how to do that. So thank you for, revolutionizing the healthcare model, because it has been a real godsend in this time. For sure.
That's awesome. You've been great.
And that's critical. That's critical at this point, Tiffany, because it's such an intrinsic piece of the delivery of care and closing the gap between in the disparity in healthcare deliveries and the delivery systems between Blacks, minorities, and whites. And those statistics are just astounding, negatively so. And when we look at what can be done, and it's starting out with the bold and courageous conversations that like we're having now, and what Linda is saying is taking the extra step to reach out to her patients or people that she's seeing in her office environment, just to ask, how are you doing? Because Black people aren't doing okay. We're
No.
really not doing okay. This is a very stressful time, on top of COVID, on top of really tough economic hardships, and with the gap in, I think somebody said the other day that a Black household, a white household earns or brings in 11 times the amount of money that a Black household brings in. And so looking at that, and all things being equal, like a master degree Black person and a master degree white person with equal households with the same things, that's what the disparity is. That's what that gap is. And when you look at that and you think about what's taking place in our lives today, economically, and my clients are calling, and I'm having to do very much like what Linda was saying, is that just stop and listen to what's happening with them. Most of my clients were in the supply chain as providers of PPEs, and that's the personal protective equipment. And they were purchasing those from China. So actually they were like brokering, but that was a substantial piece because nothing was being made here in the United States, and trying to manufacture those healthcare products here in the United States was just out, it just made no sense. It's hard enough for them to cover the cost of their doing business as a manufacturer or a distributor or a broker here in the States, much less, doing something major. So, I mean, major like the sterile equipment and whatever. So they were really hurt with COVID-19 because the equipment that they had was immediately soaked up by the docs and the healthcare systems locally. And China, they could no longer afford to buy from China because it was such a high demand. And of course, the other major corporations could buy from China and pay the difference and have the products flown here, when my poor little minority supply chain people couldn't do that. And so that widened the gap, and that increased the level of economic downturn for them. So it's been, needless to say, a very difficult and heart-wrenching time for minority suppliers in healthcare, because they were not doing that well to begin with. And then now with COVID-19 and the products that they had and the way that those products are now being sourced, and will probably continue to be sourced, because as long as they're projecting increases in the fall and shortages of the equipment and the types of products that minorities were most sourcing here in the United States, that is just really devastating for them. And for the unrest, the civil unrest to come about now, and the feelings of having to deal with all of that, it's really, really, really rough. So yes, the comments that I have to share with them are, let's take a breath, first of all, understand that these are very hard times, and just reevaluate the business models, and let's be more intentional where we can, and just start looking to talk with and have these difficult conversations or courageous conversations with hospital executives that are minority hospital executives that have always had more of a heart towards this than before. But even now, it's much more critical that minority clinics, minority-led clinics or owned clinics, the docs, and then the major health systems, the Detroit health systems, the Chicago, the other primarily Black, where the patients are primarily Black that come in to visit that hospital and receive care from that hospital. Those are the ones that we're trying to intentionally reach out to now.
That's great. It's interesting because as Linda knows, and I'm not sure if you know yet, Angela, but my father is obviously Black, right? So
Yes.
chief medical officer. So
Yes.
I've always been privy to the
I know we've had that conversation it was a long time ago, but yes, yeah.
Yeah, so
Yeah.
I knew that there was going to be incredible complexity around the medical field, right, and the healthcare system as a result of COVID, and then now we've got the compounding effect of what's happening with the civil unrest. So it's really interesting. So Linda, as we are moving forward, there seem to be some elements of the post-COVID, sort of life and work that we're quickly normalizing, right? So things that were previously impossible, like everybody works from home, suddenly have become not only possible, but the most viable option in very many cases. What are you seeing anything else in terms of shifts? Sometimes we don't know what is going to stick, and we don't know what things are going to potentially be assets until we're faced with them. So are there any shifts that are being made right now that are causing you to rethink any of the systems or structures or practices that are going on within the work that you're doing? And I'm talking about any of the work that you're doing, whether we're talking about serial entrepreneurship, healthcare itself, venture capital, you name it. But what kinds of shifts do you think will continue to be necessary, or at least continue to be useful as we ride the pandemic out and get to the other side?
It's a great question. I guess on the clinic side, I think everybody is just going to be much more careful with everything. I don't know how long we'll be taking temperatures or requiring masks everywhere, certainly for the indefinite future. But I was at a lunch with 3 physicians today, and they said that their acute care has gone almost to nothing because no one's coming in with colds and flu.
Right, yeah.
Nobody sees anybody. And so a lot of times it was, sinus infection, ear infection, et cetera. That's not happening. And so the kinds of things that we're working on next are immune system stuff. How can we build immunities, and how can we build strength in people so that if they do get this, they can fight it better? And what do we know about peptides? What do we know about different types of things that we can do with the body to help people fight these things? And how can we focus on that? Because I don't think, as you said, this is going away anytime soon. So other than just the remote, we're trying to figure out how we can we do this anyway, with always looking at the immune system and stress and hormones and cortisol and inflammatory markers and gut health and all that. But how can we really increase that ability to fight an infection? Because the way this thing hits, it hits some people just drastically and other people barely feel it. And it's really strange, but we've got to have all the tools that we possibly can. In terms of the consulting piece, I've really worked hard with some of my clients who are just panicking. I mean, they're small business owners, women. They've got their entire lives wrapped up around this business, and people aren't coming in. Got quite a few healthcare folks, small healthcare folks, and just showing them, okay, you've got the PPP loan, and that's great, and you'll get some money, but once that goes away, what's going to happen? So let's plan multiple scenarios here. If life doesn't go back to normal, how do we plan so you have a plan B, sort of like a worst case scenario? Because we all want everything to reopen and everything to go back to normal, but I don't know that it ever will go back to normal, and certainly not that soon. And so we're going to have to plan for a very different thing. At Welcome, we did a COVID dashboard where every week we look at how COVID's affecting the company in terms of insurance reimbursements, new enrollments, visits, people saying they can't continue because they can't afford it because they own a gym or restaurants. I mean, all of that, and we're tracking it. And I don't know exactly what that does, but it does one thing. It makes me feel at least more secure that I kind of know what's coming. And it's not like I get the financials at the end of the month and I go, holy crap, what happened? You at least know. And so I think in the case like Angela is talking about these minority supply chain folks, the more they can plan. I mean, all these things are super proactive and good, but they've also got to have a worst case scenario. So how do I pivot? What do I do when the things that I had depended on are not working out?
Yeah.
No, that's great. It's, you know, I mean, some of the systems and structures that you helped me reinforce, Linda, back when, you know, back in the day when you helped us out, we have now a really strong, robust legal team, a really strong financial department. And so all of the steps were put in place really quickly. When your books are in order and your stuff is, you know, set to go, then securing those loans and getting that stuff is far less challenging. So you know, just thinking about how these things are going to affect, like my board had been trying to get me to digitize training for 1,000,000 years, and I refused because I wasn't trying to give away my IP. Do you know how quickly I got digital training online after COVID?
Yeah. I bet. That's funny. But
everything is online now, and we're happy to have it there. So making the adjustments as necessary to survive. So Angela, what are you seeing as you interact with the networks that you are serving? What are you seeing as potential changes that might be permanent, things that might have to shift indefinitely?
Yeah, I think you and Linda hit the nail on the head with looking at alternatives and an alternative plan, and instead of the easier, more we call them consumable products or commodity type products, such as caps and bouffant caps and shoe covers and face masks and gloves, and those were the kinds of things that are very, very important today, but they were considered commodities, and you bought them in bulk, and so therefore, and they were all of the manufacturing moved to China. So Kimberly-Clark and all the others were looking at other kinds of manufacturing, other kinds of higher end products that requires the barriers to entry for manufacturing those products are much higher than my client base could afford. So what we're looking at is what are the needs of my clients' customers? What are the needs of the healthcare providers? And who are those providers? And what are they going to be doing? And here's the component is, what is healthcare going to look like now? And that's where the civil piece comes in, because those processes, we have the pandemic, we have the social unrest, and then we have the economic depression, if you will. So what's going to be the impact on all of that, on who's going to pay for healthcare? And who's going to be eligible for healthcare? So trying to look at that and deal with it personally, professionally, and then come up with a product or a what's the word I want to say, is a product or a source of if you don't have products, you have services. If you have services for how you're going to deliver that in today's environment, but it takes time. You just can't flip that over in a night or a day. And so being intentional and being at the mercy of policy and politics, and policy and processes, and getting those things in place so that the changes can be a little bit faster and perhaps a little bit more radical than what we have seen in the past. Healthcare delivery to Black people has been horrible for over 400 years, because Black people were not considered to be people, so therefore they did not get healthcare. So genetically over a period of years, the systemic diseases, the systemic racism that has occurred in healthcare provision and studies of healthcare has just made that gap even wider. So how do you overcome that? What are you going to do? And the wellness things that Linda is talking about are critical avenues, because through that venue, you can talk about eating properly, exercising, getting enough water, and slowly begin to change those characteristics and behaviors of wellness, or the lack thereof, for this huge population that I am a part of, and that we are looking to try to make well. And then what are the needs of that as we move forward that my customers can provide, whether they are services or actually products, to provide to Linda and her entrepreneurs and her different businesses, because that's how it all operates.
So there's two things I see here, and this is precisely why I wanted to create this vehicle of manifest equity, is so that we can look at the intersections of so many different critical things. And what I see here, like I'm talking to CEOs every day and executives every day who are figuring out how to make good after years of maybe getting it wrong or ignoring it. How do we do right by Black people? Well, now I'm hearing this opportunity that is, you know, remember the Made in America, right? We wanted to support Made in America.
Yes.
Well, one of the biggest things that you can do is economically empower Black people. We have not been on the receiving end of a lot of the economic opportunity. So, you know, perhaps as part of the, you know, I understand that, you know, everybody put out their Black Lives Matter statement and they're donating to this charity and that charity. How about your supply chain?
Yeah.
Are you intentionally shopping with Black-owned businesses? Why not pay a little bit of a premium to have manufactured goods and services that are coming from Black-owned businesses? Nothing says hashtag reparations, hashtag make good on 400 years of not so great behavior, like economically empowering those of us who have started businesses, who are providing viable services. And, you know, people will jump through the necessary hoops, but that would be a great intersection of stimulating the economy, doing right by Black people, expanding our supply chain, keeping things moving. I think that's a really great opportunity. And likewise with the direct healthcare option, you know, I live for the data, and the data tells us exactly what you said, Angela, right? The healthcare disparities for, you know, both outcomes and practices as it pertains to people of color are really, really scary. They're frightful. And so I'm hoping that we will be able to usher in a new era where not only are we quantifying the data and paying attention to it, but that we're living into new values and making choices that are intentionally inclusive and creating better outcomes for people of color, full stop. Because we're not quite there yet, but I hope that this energy galvanizes some momentum to actually, you know, gain some headway in that space.
So you bring up something so interesting, Tiffany. I would love to have an email in Richmond about what supplies do you buy and what do you need, and how can you support Black businesses, minority-owned businesses, because we don't know. We're just doing our thing. Oh, we need gauze, we need bandages, we need vaccines. What are the labs? What are the folks that do this? Let us know so that we can support it. And
I know a gal. You can talk to her.
You can talk to me, and I don't. My market is just not Richmond, Linda, but I definitely can do Richmond for you. The other thing, and this is something that I've been asking my network over the years, is that ask your primary or your major corporation people, who do you buy from? What are the women and minorities that you are currently purchasing from? Every hospital, every small doctor's office, alternate site, they all have somebody that they purchase from. And it can start with the salesperson that comes in to deliver your order, or the customer service person that takes the order over the phone. Ask the question, who are your women and minority owned companies that you are currently purchasing from? Because what the majority owned companies and the publicly traded companies used to tell me all the time, repeatedly, is that None of our docs or hospitals ever ask for minority-owned women, minority-owned companies or women-owned companies. They don't ask. So if they don't ask, why should we? So here it is. So it's incumbent upon us to have the conversations as we talk about healthcare and the economics of healthcare and the supply, who supplies our goods and services. We ask the question, where are they coming from? And under the Obama administration, early on in the administration, there was an act that came out of the federal government that said they were going to reduce the number of supplies ordered through China. And there was a certain number of medical supplies that you could not order through China. Well, all of a sudden, that gave a huge boost in the minority-owned manufacturers that were here in the United States. And so they started ramping up to accommodate that. Then now, mysteriously, all of that has disappeared. So they had invested in plant and invested in other things. So therefore, that's when we talk about the political realm, political activities, and how can that have an impact? So let's start, Linda, with you and I talking about what's available here. And you're raising the
Charlotte.
question.
I have a clinic in Charlotte. I'm opening one in Naples, Florida. So
okay, excellent, excellent. I've got lots of people that can help you from everything from setting up your beds. They can come in and do a whole complete examining room for you, from the drawers to everything. And they set that up, and they do it all over the world. They did it in South Africa. They did it in, what was the other? There was another place, but it took someone asking the question. And it's as simple as that. So we can start there. Let's start there. And making the connections, and I'll be glad to do that. Thank you, Tiffany. Thank you, Linda.
Absolutely.
Yeah.
Well, the other thing I just want to mention is I've gotten, as Tiffany knows, more involved in private equity over the years. I sit on the board of a concierge company owned by private equity in Chicago. And there's a sub-conversation going on that a lot of people in private equity don't want to have, but I'm trying to push it a lot. You look around at the analysts, the people, I mean, the stats on women getting investment dollars and minority CEOs getting investment dollars are absolutely disgusting.
They are.
And I'm the only woman on the board of this one company. They own like 30 companies. There's probably 2 other women. I go to a private equity CEO conference, and I'm usually the only woman, and maybe there's 1 person of color there with 80 people. And it is disgusting to see. It's like we're just perpetuating this in terms of access to capital. And it's a whole longer conversation and maybe a different conversation, but we've got to be shifting this around, and we've got to be sort of putting up front and center with these companies that, okay, so you only invest in companies with $1 million in profits and 5 million in revenues. How about you have another arm? You're printing money that invests in companies with 100,000 in profits and $1 million in revenue, or losing money, but on the way to making it, and minority women-owned businesses, because it's got to happen. And a lot of people just don't have mentors in this area. They
no, because they're not interested.
How to do it.
And that's a very difficult conversation and a very courageous conversation to have, Linda. For white people, it's very, very difficult to go to a group of all white men on a board, which is usually the case, which is another issue, and an example of systemic racism. But to go and say, what's going on here? As I look around, I'm the only woman and only 1 other person of color, and they probably are not Black in healthcare. So
no, it was an Indian gentleman.
Yeah, and that is often the case, because so when I look at my clients that are subcontinent Asian, they are the ones that are doing the scaffolds and some of the other instrumentation that, because they have connections in India and Germany.
Right.
But here, when we get back to, as Tiffany mentioned, made in America, what do we have? And so we have there's an organization that I founded called the Healthcare Supplier Diversity Alliance. And I can send you the website and the link to that. But we've got a couple of former athletes that are on our board. But they are investing in our members who are minorities, not just Black, but minorities and women in the healthcare supply chain. So that is one component of investment. But this is why I'm so passionate now about the time is come. We got to rip the Band-Aid off of the cancer, because the Band-Aid is not stopping the cancer. We have to have courageous conversations, difficult conversations about systemic racism and how it is connected, healthcare, education, economic downturns, all of that. We've got to address that and to say, what are we going to do about it? But the first thing we have to do, have a conversation. And until that's had, we're still just kind of like dancing around it. That's my perspective.
I didn't lose it, but because I don't usually lose it, but I did have an issue. I've got this incredible health coach in Charlotte named Luis Perez, and everybody, when I got there in the office, called him Louis. And I said, what would you like to be called? Well, my name is Luis, but I don't care. They can call me whatever. I said, you do need to care. Yeah. And we were in a meeting and I said, do you guys realize what you're doing? Yeah. This gentleman's name is Luis. And we need to call him by his name. We don't need to Anglo-Saxonize him, if that's even a word. Right. And make him something he's not. Let's be proud of who he is. And it's those kinds of things that I just see and I'm like, really? Are you kidding me? Do you think if you call him Louis, he'll get 5 shades whiter? It's not gonna happen. He's from the Dominican Republic. It's not gonna happen.
All right, ladies, I want to have this conversation.
Do we have to stop?
I want to talk for the next 5 hours. This is amazing. I have to say, I'm so glad that we had to reschedule because so much has changed in the world in that time. And this is a different conversation than we would have had weeks ago.
Yes,
so,
it is.
Thank you so much. If you want to leave one final thought with everyone, if there's anything in particular that you want to promote, anything that you want to lift up, or any social media, website, now's your time to plug whatever you want people, where they can find you if they want to know what you're up to.
Well, WelcomeMD, as Tiffany knows, and my consulting is Linda Nash Ventures. So that's
Linda Nash Ventures. All right.
Okay.
Angela?
And Angela T. Wilkes with A.T. Wilkes and Associates. And the message I'd like to leave with you is that in healthcare, we cannot be silent anymore.
Beautiful. I love that.
Thank you so much, everyone. I appreciate you being here with me.
Thank you. We'll talk to you later. Thank you. Bye-bye.
Bye.